Hey guys, well, welcome back to another session on our Luna U site where we talk about all things maternal health. I know I haven't done some of these in a while, but I'm super excited because we have new development in the maternal health world. And so we love to be at the forefront of this. I'm super excited to welcome my sister Adeiye to our call today where we are going to be talking about maternal health. She is a filmmaker. She is currently at Brown. I'm going to let her introduce herself more in depth, but thank you so much, Adeiye, for being here. Tell us a
Thanks
little
so
bit
much.
about yourself. Yeah.
Thanks so much for having me, Courtney. My name is Adeiye Osinubi. I am a third-year medical student at the Warren Alpert Medical School of Brown University in Providence, Rhode Island. I've actually been in Providence for many years because I went to undergrad at Brown. And so starting from my first year of medical school, there was a lot of awareness being raised about the Black maternal mortality crisis. A lot of us are familiar that Black women may be 3 to 4 times more likely to die due to childbirth related causes. And that disparity is higher in different parts of the country. I know New York, it can be up to 8 times. And so seeing all this news media attention, it of course really affected me as a Black woman myself who hopes to start a family in the future and also someone who was going into the medical field. I thought this was really important to address. But however, when there was a lot of information about Black maternal mortality, I didn't see that much information on Black women's experiences navigating other parts of reproductive health care. So infertility, postpartum, and so I come from a background of documentary work and photography. And so that's why I decided to start this documentary series to kind of have a wide ranging look at Black women's experiences in navigating the reproductive healthcare system from conception to postpartum. And so that is why I created Black Motherhood Through the Lens. And it is currently a 4-part documentary series about 4 Black women's experiences navigating the reproductive healthcare system.
That's so awesome. So Luna U, it's a part of BIF, which is Business Innovation Factory. And one of the things that BIF has done is um, highlight the importance of a story, right? Like we each have a story and how we tell our story is like super important. And so we at Luna U find it very important that we're just not like just saying like, Black women are dying, so you should care. But like, no, like this person, there's a person behind each patient, each statistic. They have their own stories of how they got here. They've had their own hopes and dreams. And so we really try to provide a voice for women to say, not just a number, not just a patient. This is someone with a very complex story, and I love how you kind of do that in that 4-part docu series on that. So, can you speak more about like just stories or what you've learned about some of the women that you've worked with?
Mhm. That's a great question. And yes, the power of storytelling is amazing. And that's why I wanted to tell those stories through film because people connect to things that might not necessarily affect them through film. And so some of the stories that I feature in this documentary series, I have one woman who experienced infertility for a number of years, but she was unable to access assisted reproductive technologies such as IVF because she did not have insurance. So she kind of talks about what a lot of women go through in having trouble accessing fertility care because that can be really expensive. I think the average cycle of IVF can be between like $10,000 to $12,000, depending if it's out of pocket. I have another woman who talks about her experience with postpartum depression and how she needed to go on medication to treat it. However, due to stigma in various communities, she actually hid her medications. And then I also have another woman who talks about her experience giving birth. I met her when she was about 8 months pregnant. And she discusses the fears that she has in giving birth as a Black woman. She wound up having a great experience because she had a predominantly Black care team in which she felt very comfortable. So those are just some of the stories I was able to capture through these series. And meeting the women was also a great experience. I have individual stories of how I've met all of them. I won't go into that now, but it's been a great experience.
Awesome. And how do you think like your medical background has really helped you kind of pave the way in this area?
That's also a great question. I think coming from a medical background has its pros and cons. Of course, I understand more the pathophysiology of infertility, the pathophysiology of postpartum depression, which, I mean, there's still like a lot of research. So it definitely gave me that clinical knowledge to really understand. But in the medical field, it's very easy to be like, oh, this is in the textbook, and then just to not really be as empathetic to those stories. So I had to really make sure that I was connecting with them one on one. It wasn't just medicine, because sometimes you forget that there are real emotions attached to this. I mean, I had a woman who had a miscarriage and just experiencing infertility for many years. It's really emotionally taxing. So I think that coming from the medical field, it did give me that knowledge, but it also taught me how to become a more empathetic healthcare provider in the future, especially when I start to see my own patients when they come into me with various health conditions, and just making sure that I am listening to them. I'm being compassionate, because oftentimes medicine, you have every 10-minute appointments. So, it's kind of like a well-oiled machine. So it's definitely allowed me to understand more of the provider I want to be in the future.
I love that. I love that. And so like what's like one word of advice that you would give to black and brown women that are coming in, maybe this is their first baby or they've had multiple pregnancies. One word of advice from your medical standpoint and as someone that has filmed this, told the story? And then what's one word of advice that you would give your colleagues as well?
Mhm. Advice to women giving birth. That's tough because I've never been pregnant. So I would say, I mean, this is kind of goes without saying, and it can be challenging for other people, but really advocating for yourself is important. Don't be afraid to fire your doctor if they're not giving you the care that you need. We're here to serve you. And so if you're not getting the care that you need, it's okay to find another provider. Sometimes it's challenging, of course. Health insurance, depending on how late along you are in the pregnancy, you might not want to just switch providers. But just knowing that that's an option, and then also advocating for yourself is really important, but it's sometimes just challenging in, the current social climate, especially how Black women are viewed, to really have your voices heard. So I know a lot of Black women do advocate for themselves, but it's not necessarily received. So that kind of brings me to advice to fellow colleagues. As medical providers, I've seen this thing where people say treat race as a risk factor. I don't necessarily agree with that, because it kind of perpetuates this idea that there are biological differences due to race. I think the importance of that statement, and what I feel people are trying to get is, pay special attention to Black women when they're giving birth, because they are more likely to die during pregnancy related causes. So make sure you're taking that extra 5 minutes to listen. If someone says a complaint, really be like, okay, what's going on here? And don't just blow things off, because I think being extremely detailed is really important and helps. It helps things from being missed. And so that, I think, would be my advice is, of course, you want to treat all patients with respect. People say treat all patients equally. That's also hard because people are coming from different backgrounds. So I think equity is a better word for that. And just being aware of the different needs your patients might need.
I love that. I love that so much. I think listening on both sides is like equally important. I tell women all the time, listening to your body, listening to your emotions, that instinct, like if something doesn't feel right, then it probably isn't right from your medical care provider. And really to put you back into the driver's seat of pregnancy, right? Like this pregnancy, you're at the center of it. And so you are able to tell your provider, how are you feeling? Or I didn't feel like you heard me when I said that, or that really hurt my feelings when you didn't take that into account, or I'm really trying. And so it's really been an honor to kind of give women and mothers, because as a mother myself, I have a complicated birth story myself, but I know there was some things that I just didn't know when I was pregnant for the first time, that I'm like, oh, I can ask that. Oh, I can say that. Oh, I can do that. And I had an amazing midwife that I'm so grateful for. And she like helped me navigate through this whole process. But for those that might not have an amazing midwife to navigate through the birthing process, they still should have, everybody should have access to a healthy and whole birth, and not based on their insurance plans, not based on their skin color, or, you know, whether they talk English or Spanish, none of that. It should just be based on, because we are human and we all deserve to have a healthy chance to have a fair birth, and not judgment in that. So that's awesome. Well, thank you so much, Adeiye, for just your time, your effort, your work in this space. How can we access your series, and how can we help to support the further work that you're doing?
Black Motherhood Through the Lens is currently in the film festival circuit. So it's been in about 4 so far, waiting to hear back for more. So that's going to last about a year. And so then I plan to publicly release the film sometime next spring. But apart from film festivals, a lot of them have been free. So I will continue to update that on my website, which is www.blackmotherhoodfilm.com. I'm also doing various events with different organizations. I actually have one coming up on May 17th, and that one's about postpartum. But yeah, so I've been collaborating with various organizations, so I'll continue to upload those to my site, and I oftentimes screen at least like 1 or 2 of the films as well. But after all of that is said and done, I do plan to have them open up on YouTube or Vimeo for everyone to be able to watch.
Awesome. Thank you so much. We end our sessions every time the same way, where we let the person know that you are indeed magical. So thank you so much just for your time, your work in this space. Like, it's not gone unseen. We really do appreciate it. And thank you for being part of our Luna U network. Thank you so much.
Thanks for having me. It's a
Yeah.
pleasure.
Okay, so I'm going to